What are the common leukemia risk factors? Have you ever wondered what factors might increase the risk of developing leukemia? Understanding these risk factors can help us learn more about this complex disease. Leukemia is a type of cancer that affects the blood and bone marrow. There are several common risk factors associated with it, which can be grouped into genetic, environmental, medical history, and lifestyle categories. First, let's talk about genetic and congenital conditions. Certain inherited syndromes can raise the risk of leukemia, especially acute forms. For example, Down syndrome, Fanconi anemia, and Li-Fraumeni syndrome are linked to a higher likelihood of developing leukemia. These conditions often affect how our cells grow and repair DNA, making blood cells more susceptible to cancer. Additionally, having a family history of leukemia, like a parent or sibling with the disease, can slightly increase your risk, although most cases are not directly inherited. Interestingly, identical twins of children diagnosed with acute lymphoblastic leukemia before age 6 have a higher chance of developing the same type of leukemia. Next, environmental exposures play a significant role. High doses of radiation, such as from nuclear accidents or radiation therapy for other cancers, are well-established risk factors for several types of leukemia, including acute myeloid leukemia and chronic myeloid leukemia. Furthermore, contact with certain chemicals, particularly benzene, which is found in cigarette smoke, can increase the risk of acute myeloid leukemia in adults. Speaking of smoking, it is a proven risk factor, especially for acute myeloid leukemia. Now, let's consider medical history and blood disorders. Individuals with pre-existing blood disorders, like myelodysplastic syndromes or chronic myeloproliferative disorders, have a higher risk of developing leukemia. Additionally, previous chemotherapy or radiation treatments for other cancers can increase the risk of leukemia later in life. Viral infections can also be a factor. Some rare viral infections are linked to specific types of leukemia. For instance, the human T-cell leukemia is associated with adult T-cell leukemia, while the Epstein-Barr virus has been linked to certain leukemia subtypes. Age and gender are important too. Generally, the incidence of leukemia increases with age, particularly for chronic leukemias. However, acute lymphoblastic leukemia is more common in children. Interestingly, leukemia tends to be slightly more common in males than females, although the reasons for this are not fully understood. Lastly, other factors like race and ethnicity may influence risk. For example, acute lymphoblastic leukemia is more common in white populations compared to African Americans, though the reasons remain unclear. Understanding these risk factors can help identify individuals who may need closer medical monitoring. However, it's important to remember that many people diagnosed with leukemia have no known risk factors, and having risk factors does not guarantee that leukemia will develop. If you have concerns about your risk, it is always best to consult healthcare professionals for personalized advice.